Okay, so ready to dive into a medical mystery.
Always.
This one really drives home why those regular checkups are so important.
Even when you feel fine, right?
Exactly. We're going to be taking a deep dive into a case study from the New England Journal of Medicine. It's called, get this, Hypertensive HeartBreak.
Ooh, catchy title.
Right. So picture this. You're going in for like a totally routine surgery,
Yeah.
knee replacement. Millions of people get those, right?
Yeah, pretty common procedure.
So you're expecting to recover, obviously. But what if there's like this hidden health issue
Oh,
that turns this routine thing into a fight for your life?
that's definitely a twist no one wants.
No kidding. And that's what makes this case so fascinating, right?
Yeah, it really shows you how something seemingly straightforward can, like, completely change in an instant
Totally. And how, all the different systems in your body are connected.
in ways we don't even think about sometimes.
Exactly. So our patient, he's a 61-year-old construction foreman.
Okay, sounds pretty active.
Yeah. Seems healthy overall, except for, chronic knee pain.
Makes sense why he's getting the knee replacement then.
Right. So he's about to have this total knee replacement. Pretty standard stuff. But here's the thing.
What's that?
The man hasn't seen a doctor in 20 years.
Wow, that's a long time.
No kidding. And that's a really important detail here.
I bet. Highlights how, you might not always be aware of what's going on, even if you feel okay on the surface.
Exactly. And as we're going to see in this case, not keeping up with those regular checkups can have, serious consequences.
Makes sense. It's like thinking your car's fine because it drives okay, but then you realize you haven't changed the oil in years.
Ooh, good analogy.
Eventually, that's gonna catch up with you, right?
Oh, absolutely. So during one of his pre-op visits, the medical team discovers our patient has high blood pressure.
Okay.
Leads to a diagnosis of essential hypertension. They prescribe him hydrochlorothiazide to manage it.
Standard treatment.
Yep.
Surgery itself goes off without a hitch. But get this. The day after, while he's doing physical therapy, his blood pressure just skyrockets.
Skyrockets. Like, how high are we talking?
216/99.
Whoa, that's not good.
Major red flag, right?
Definitely. That's a hypertensive emergency. Meaning something is very wrong. This isn't just like typical post-surgical pain or stress.
It's like his body's like screaming for help all of a sudden.
And to make matters worse, he starts showing signs of pulmonary edema.
Which is?
Fluid in the lungs. Another sign that something's seriously off.
So the medical team immediately starts trying to, figure out what's going on.
Yeah, I got to find the root cause.
They rule out all the usual suspects, common surgical complications.
Accessible first step.
And then they start considering rarer possibilities, like a condition called pheochromocytoma.
Pheo what now?
Pheochromocytoma. Ever heard of it?
Can't say I have. It's not something most people are familiar with. Basically, it's a tumor, releases adrenaline, can cause, you guessed it, dangerously high blood pressure.
So that can explain what we're seeing with this patient.
Exactly. It's not a common diagnosis, mind you. But when a situation escalates this quickly, you got to consider everything, right?
Makes sense. Cast a wide net.
Exactly. So it's like his body is just being flooded with adrenaline nonstop, and the medical team is racing against the clock to figure out why.
High stakes.
Unfortunately, it just keeps getting worse. He goes into shock. Multiple organs start to fail.
Oh, no.
And he even suffers a cardiac arrest.
That's serious.
They're able to resuscitate him, but he remains critically ill.
So they're still fighting to figure out what's causing all of this.
Right. Tests reveal evidence of something called shock liver.
Shock liver. Never heard that one either.
The medical term is ischemic hepatitis. Basically means his liver isn't getting enough blood flow.
Okay, so that's another piece of the puzzle.
It is, but it's still unclear what's at the root of it all.
The shock liver finding is definitely a big clue, though. Tells us there's a serious problem with his circulation. This is a full-blown systemic crisis, not just a localized issue anymore.
It's like the case just took a turn down a dark alley. And then, to make things even more complicated, they do an echocardiogram.
Okay.
This reveals that he has severely reduced heart function.
Not good.
But in a very specific pattern, suggests a rare form of stress cardiomyopathy.
Stress cardiomyopathy.
Also known as Takotsubo cardiomyopathy.
Takotsubo. That rings a bell.
You might have heard it called broken heart syndrome.
Right. Usually happens after, like, a really stressful event.
Exactly. But it can also be caused by, get this, a sudden surge of adrenaline.
Wait, so the adrenaline from the pheochromocytoma could actually be contributing to his heart problems too?
That's the thinking. The Takotsubo cardiomyopathy finding really strengthens the suspicion of pheochromocytoma.
Because of that constant flood of adrenaline?
Exactly. It's like a domino effect.
One thing leading to another.
Sadly, despite the medical team's best efforts, the patient's condition doesn't improve. He passes away just 5 days after that initial knee surgery.
Oh, wow. That's a tough one.
It really is. And the autopsy, it reveals a large tumor on his adrenal gland.
Confirming the pheochromocytoma diagnosis.
Yep. This tumor had been silently releasing adrenaline all this time, unknowingly setting off this chain reaction that ultimately took his life.
It's tragic.
Yeah.
And you can't help but wonder, what could have been done differently? But before we get into that, I think this case really highlights something crucial for both of us and for anyone listening.
What's that?
It's so important to consider rare diagnoses when the common explanations just don't fit.
Absolutely. Sometimes the most obvious answer isn't the right one, and that goes for medical mysteries just like anything else in life.
Couldn't agree more. What really strikes me about this whole thing is like the element of surprise.
Yeah.
This guy, he was living his life, working, being active, no outward signs of a problem. It really makes you think
It does.
about how much we still don't know about the human body,
Yeah.
and how these like silent but deadly conditions can develop just under the radar.
It is a little bit scary. It makes you think, okay, this is all well and good, but what can I actually do about it, right?
Right.
So what steps can we take to be more proactive about our health?
Well, first and foremost, this case, it really highlights how important those regular checkups are. Even when you're feeling perfectly healthy.
They're essential.
They are. It's like taking your car in for like regular maintenance.
Okay, yeah.
You might not notice any problems, right?
Yeah.
But those checkups, they can help catch potential issues, early on.
Before they become big problems.
Exactly, before they become major headaches. Like in this case, imagine if this patient had been getting regular blood pressure checks.
Yeah.
That hypertension, it might have been caught and managed, way earlier.
Right, right. An ounce of prevention is worth a pound of cure, whatever that saying is.
Exactly. But, I get it. It's not always easy to make time for those checkups.
Yeah. Especially if you're like really busy or don't have, easy access to healthcare.
Yeah, that's a real barrier for a lot of people.
So for our listeners out there who might be facing those kinds of challenges, what advice would you give them?
Well, even with those challenges, there are things you can do. A lot of community centers and even some pharmacies, they offer free blood pressure screenings.
Oh, that's good to know.
Take advantage of those. And also, just being aware of your family history can make a big difference.
Oh, yeah.
If like heart disease runs in your family or, other conditions, you got to be extra vigilant.
Be proactive.
Exactly. Talk to your doctor about like what screenings might be appropriate for you.
So knowledge is power, as they say. The more you know about your family history, the more you know about your own like baseline health.
Right.
The better equipped you are to, advocate for yourself.
100%.
Make informed decisions. It's also important to like listen to your body.
Oh, yeah.
If something feels off, don't ignore it.
Your body, it gives you signals. You got to pay attention to those. Yeah. You're your own best advocate when it comes to your health.
Yeah.
Don't brush it off if something doesn't feel right.
Yeah.
Talk to your doctor. Always better to be safe than sorry.
Hmm.
And this case, it really underscores that point.
It does.
You got to pay attention to those like subtle cues your body might be giving you.
It's like you're a detective, right?
Kind of, yeah.
Gathering clues about your own health. So in this case, the skyrocketing blood pressure, the pulmonary edema, the shock liver, the unusual heart failure, those were all like clues pointing to something more serious going on.
It's like putting together a puzzle.
Right. Yeah, exactly.
And for our listeners, the ones in the medical field, this case is a perfect example of why you got to keep an open mind. Sometimes things aren't clear cut. To consider all the possibilities, especially when a patient's, deteriorating quickly.
Yeah, connect the dots. Be willing to like dig deeper when things don't add up. And it's, I don't know, kind of fascinating.
Yeah.
And a little bit scary to think about the power of adrenaline in all of this.
Oh, yeah.
We usually think of adrenaline as that, fight or flight hormone that kicks in during stressful situations. But in this case, it was constantly being released by the tumor, pushing his body into overdrive and eventually leading to organ failure.
Too much of a good thing.
Right. It's crazy.
Adrenaline is essential, don't get me wrong.
Yeah.
But too much of it can be really harmful.
Yeah.
This case really shows how delicate that balance is within our bodies and how even like these small disruptions can have these huge cascading effects. And going back to what we were talking about earlier, family history, this is another reason why it's so important.
Okay.
The patient's brother, he had coronary artery disease,
Yeah.
which suggests there might be some genetic predisposition to cardiovascular issues.
Right. So that family history could have been another clue for the medical team.
It could have been. Absolutely.
It really highlights how important open communication is between patients and their doctors.
Oh, for sure. It's a partnership. You got to be honest and upfront with your doctor
Mm.
about your medical history, any symptoms you're experiencing, no matter how small they seem.
Yeah, that information can be so crucial.
It can. It can really make all the difference in getting the right diagnosis and treatment.
This deep dive has really been, like, eye-opening. Given us a lot to think about.
It has. It's been a good one. But, it's not just about dwelling on the negative. It's about empowering ourselves to take control of our health. This case, tragic as it is, can be like a wake-up call, a catalyst for change.
I love that perspective. So as we move toward wrapping up this episode, what's like the one thing you want our listeners to take away from all of this? I love that perspective. So as we move toward wrapping up this deep dive, what's like the one thing you want our listeners to take away from all of this?
I think this case, it really underscores like a fundamental truth. We are all, in a way, walking mysteries.
Ooh, I like that. Walking mysteries, huh? Explain that a bit more.
Well, I mean, we go about our days. Like, we think we know our bodies.
Yeah.
But this case, it shows us how, like, even hidden conditions, they can develop silently. It's a reminder to approach our health with a little bit of curiosity and a willingness to, like, investigate.
So not just going to the doctor when we're sick, but really trying to understand our own health.
Exactly. Even when we feel fine.
Even when we feel fine, yeah.
If this man, if he had been more in tune with, like, subtle changes
Yeah.
and sought out, medical care sooner, maybe things would have been different. It's a call to action for all of us, really.
To be more proactive.
Exactly. Ask questions. Don't be afraid to advocate for ourselves.
So it's not about living in fear.
No.
It's about being empowered
Yes.
with knowledge.
100%. Knowledge is power, especially when it comes to our own bodies, right?
Right.
It's about understanding that, like, we have a role to play in our own health narratives. We're not just like passive passengers. We could be active drivers.
Love that. Active drivers of our own health.
This case, as heartbreaking as it is, it can be, a catalyst for that kind of shift in thinking.
It's about taking ownership
Yes.
of our health.
And being informed partners in our own care.
Well said. I
Thank
think
you.
that's the perfect note to end on. A huge thank you to our expert for guiding us through this case. It was definitely complex and definitely gave us all a lot to think about.
My pleasure. Always happy to be here.
And to our listeners, we hope this deep dive has given you some, knowledge and, more importantly, inspired you to take charge of your own well-being. Until next time, stay curious.